Governor Steve Bullock signed one of the biggest bills of the 2019 session today, the continuation of Medicaid expansion, which provides health coverage to more than 90,000 low-income Montanans. But it wasn't the only health care measure to become law this day. MTN's Mike Dennison reports.
Scores of lawmakers, health officials, and supporters packed the governor's conference room Thursday as he signed not only the bill to continue Medicaid expansion in Montana, but several others to tackle everything from prescription drug costs to mental health treatment.
These priority bills work together to protect the progress our state's made in recent years to provide quality and affordable health care to all Montanans. They'll further our efforts to increase access, reduce costs, and improve the quality of care.
Bullock signed 4 bills Thursday. 5 others had been signed earlier but were part of the ceremony. They included a bill from Representative Jessica Carjala of Billings to fund suicide prevention efforts with a special emphasis on military veterans.
Montana has one of the worst suicide rates in the nation, though we are improving, but our veterans commit suicide at twice the rate of other people.
And another bill from Representative Jonathan Windyboy of Box Elder establishes community health aides on Montana's Indian reservations.
The tribe's Indian Health Service programs will triple their third-party revenue, and as well as also have the ability for the dental health aid technicians, behavioral health aid technicians, mental health aid technicians.
But the star of the ceremony was House Bill 658, the bill from Republican Ed Buttrey of Great Falls that continues Medicaid expansion in Montana. Medicaid expansion will bring $1.4 billion of federal money into the state over the next 2 years and cover an estimated 90,000 people. And the state treasury's net share of the cost will be a mere $16 million. Supporters of the bill flocked to the ceremony at the Capitol, and Bullock gave them and all the program's advocates a special thank you.
And thank to all of the rest of you gathered here and in every corner of the state that worked hard, who talked to legislators, who organized in communities, who underscored the importance of health care to make sure that this could happen today.
The big dog in this health care pack is certainly Medicaid expansion. But the rest of this group of bipartisan bills takes aim at health care problems facing many more Montana citizens. At the Capitol, Mike Dennison, MTN News.
Well, despite today's signings, the governor also vetoed a significant health care measure. That measure meant to lower prescription drug costs. Now, Bullock says the bill could lead to higher drug prices for customers of smaller health insurers and reduce choices for consumers.